This Be More Lifestyle Extra is sponsored by GBMC Healthcare.
Well, doctors say that it is safe to receive medical care if you need it, but a lot of people still have concerns about COVID-19. So joining us to discuss why our health issues still need treatment is Dr. Harold Tucker. Hi, doctor. Now tell us, why should we still be treating our chronic conditions during this time?
Well, certainly I think we always want to make sure that we manage ourselves to prevent any complications. Diseases that are chronic tend to progress over time and complications can develop. But even when you don't have a chronic disease, you may have situations that need preventive care, immunizations, as we now are all talking about with COVID, but also screening tests to prevent cancer. All these things need to still be attended to.
Why should we not be afraid to still seek that care during this time?
So certainly one should be concerned, and certainly one should be cautious about it, about reassessing the value of the office visit. Is that the only way to be evaluated? So we use video visits and telephone encounters. So we have made great strides in making sure that in our offices and in the hospital, we are doing everything we can to keep not only the patient safe, but ourselves safe as well. So frequent washing, everyone wears a mask. So I can't enter the hospital without a mask on. We have screening procedures. So we're labeled that our temperature was taken. We answered various questions to make sure that we don't have any COVID symptoms. All these things are done to provide safety for both the staff and most importantly, the patient.
So that's what I was going to ask you. What kind of procedures are in place? You just went over them. Could you tell us again quickly?
So if you're coming for surgery, you have to have a test for COVID before you're allowed to have surgery. If you're coming to the hospital or to any of our office practices, you'll be asked to bring a mask with you. You have to wear a mask as you come in. You'll be screened for temperature, screened for symptoms. You can count that everybody else is wearing a mask and proper protective equipment in the office, so all our personnel are properly garbed. And we wash very carefully and very frequently, and we wash all the surfaces very frequently. We've put up plexiglass screens to prevent any contamination, even as you register with the receptionist. So we're doing everything we can. The emphasis on reducing exposure in every which way.
Thank you so much again, Dr. Tucker. And for more information, visit the website there on the bottom of your screen.
This Be More Lifestyle Extra was sponsored by GBMC Healthcare.